Welcome to Super Screens News on the R. Here are some stories making rounds at this time.
Tuberculosis, popularly known as TB, is said to be one of the major communicable diseases worldwide, as no less than 10 million people develop the disease and account for 1.6 million deaths every year. In view of this, the Kwara state government has partnered with Sustained Health Outcome through the private sector, an initiative meant to train private health practitioners in the state on tuberculosis management. Speaking with newsmen in Ilorin, the state capital, the coordinator Shop Plus, Dr. Flora Nwagabo, noted that the training course is to enable public-private mix (PPM) with view to putting an end to tuberculosis, as Nigeria counts the highest number of TB cases in the world and highest in Africa, with over 400,000 people with TB cases.
Is a project that is targeted at working with the private sector to provide TB services, quality TB services through the private sector. So Kwara State is one of the states in Nigeria that we are currently working with. The aim is to increase TB case detection and treatment by working with the private sector. Before now, a lot of private facilities were not providing TB services. So it is hoped that with the onset of this program, this will change. Currently in Nigeria, Nigeria accounts for one of the highest burdens of TB in the world. We are actually the country with the highest burden of TB in Africa. Currently, we have well over 400,000 people with TB, and several of them are missing. So we are hopeful that if the private sector, which accounts for more than 60% of patient population, begin to take part in TB case finding, we're likely to have an increase in case detection and reduce the burden of TB in Nigeria.
Relatedly, the state public-private mix facilitator, Morenike Koyejo, noted that training will lead to increase in community participation in the search for TB patients in the state and in Nigeria at large.
Increase community participation. The community will participate, a lot of community volunteers will be recruited to do house-to-house search of people living with TB. And so, obviously, this will lead to increased case detection of tuberculosis in Kwara State and in Nigeria as a whole. Because it's also a known fact that Nigeria as a country is underreporting tuberculosis. And currently, tuberculosis is the most deadly infectious diseases. Even it kills more people than HIV/AIDS.
Over 300 health workers drawn from 9 local government areas of the state are expected to be trained at the end of a week-long training.